Andy Cochran is Chief Executive Officer of Maple Grove Hospital and has served in that capacity since November of 2008. Prior to relocating to Minnesota, Andy was Administrator and Chief Executive Officer of Methodist Willowbrook Hospital and Senior Vice President of the Methodist Hospital System in Houston, Texas. He has served in various hospital leadership positions since 1989, both in Virginia and in Texas. Mr. Cochran has a very timely message for all of us today. Together, delivering health care as it ought to be. Ladies and gentlemen, please welcome to the NRC Picker Symposium, the Maple Grove team and Andy Cochran.
Good morning. I'm Kate Law, and I believe our success is due to an inspiring vision, a values-based work environment, and an engaged team.
Hi, I'm Colleen Nadeau, and I believe that our success is because our processes are hardwired and aligned with our culture.
Good morning. I'm Linda Engdahl, and I believe that healthcare excellence is achieved when our strategic priorities are aligned with our cultural values and each supports the other. Most importantly, relationships are the keystone to healthcare excellence.
I'm Jennifer Krippner, and I believe that our patient and our family experience shapes our work through active listening and responding to stories.
Good morning, I'm Craig Wolgemuth, and I believe that a culture that values innovation and technology enables our ability to deliver individualized care.
And I'm Andy Cochran. I believe that our vision, together delivering healthcare as it ought to be, is lived out every day through our staff, our physicians, and our volunteers. And it's a pleasure to be here this morning and tell a little bit of our story. It's timely, I think. You guys can go sit down if you want. It's timely, I think, to build on some of the other talks that have been given. I have to admit, it's a little intimidating to follow a speaker that people say, he's the best speaker I've ever heard at one of these. I don't do this for a living. My folks know that I love to talk about this. So it's not about not knowing the content, but I don't normally talk about it in a setting like this. So I'm just your, well, not typical CEO, but I'm just a CEO who's telling our story. And our story is really one of engaging people around a single vision that people can understand what their part is in delivering healthcare as it ought to be. And I'm going to share a little bit about how we got to that point. But let me start with, are there any other CEOs in the room? Perhaps there should be. CNOs, COOs, I know there's a CIO at least. CFOs? Yeah, duh. Okay. So, similar to Sean's message, I'm going to encourage you just to listen to our story and not resist the temptation to take a lot of notes. The one message that you need to take away from this is that culture matters. Culture makes a big difference. And our story this morning is a little bit about how it's made a difference at Maple Grove Hospital. Let me start with a little bit about who we are. We're located in Maple Grove, Minnesota, which probably conjures up pictures of wagons and Laura Ingalls Wilder. That's Walnut Grove, Minnesota. Maple Grove is actually a suburb of Minneapolis to the northwest. It's a growing area, and the state officials almost 10 years ago determined that because of the projected growth, we needed a hospital in that area. Now, everyone in the Twin Cities, every provider, every organization said, oh, we have to build that hospital. In the end, the hospital opened in December of 2009 as a partnership between North Memorial Healthcare, which is predominantly a standalone, independent trauma center of about 500 beds with a large medical transportation business, owned physicians, and Fairview Health Services, which is a very large integrated delivery system in the Minneapolis market. The partnership has served us very well. North Memorial owns 75%, Fairview 25%. So my board meetings are the executives of each organization, which makes it a lot of fun, usually. We opened as 90 beds, a lot of OB. As you might imagine, in a younger, growing community, our surgery programs continue to grow. We've added things like orthopedic, joint replacement, spine, a lot of general surgery. We're adding 40 beds, building out our final floor to get to 130 beds this year. Our OB program is now over 300 deliveries a month. The last 2 months, we've averaged about 340. Our emergency department is 80 to 100 visits a day. So just to give you an idea of how rapid some of the growth has been, and that's been a challenge for us. We had the chance to build something very new, and part of the message here is that, yes, we looked at process. It was an opportunity to look at process in a different way, perhaps change the way we thought about how we have been doing healthcare for a long time. We used principles of Lean and Six Sigma really to reduce the waste in the facility that we were about to build. We built the facility, designed it, and then bought technology to support the change in process. All of that's critical and I think typical of what a hospital would do. We also had a very intentional and probably equal focus on what we wanted the culture to feel like. Who were the employees going to be that we were going to hire, and how would they interact in the work that they did? So we held open houses before the hospital opened. We probably had 500 or 600 people total in those open houses. And we presented a lot of this information. We talked about what people were going to be held accountable for, too, what was going to be expected of them, the fact that we were going to hold ourselves as a leadership team accountable to that. And I said at the end that you're going to be driving home and you're going to have basically one of two feelings. One is, that's the most awesome place, I have to work there, that's what I've been looking for. Or, that's too touchy-feely. The CEO's too soft, I don't really like that. It's too different from what I'm used to. And I encouraged those people to be honest, and they need not apply, because we were going to hold people accountable to this culture. And in the end, I think what we ended up with was a culture that was very focused and aligned on creating an exceptional patient experience, and the fact that everyone has a role in that, and I think that's been a big part of our success. Our goal was obviously to create and build a new facility that met the needs of the community, but we really wanted to think of it differently. What would a hospital in the future look like? What would it feel like? What would the services be or not be? How would technology play a role? Our mission statement we borrowed from North Memorial, one of our parent companies, to inspire each other to give our patients and their families compassionate, remarkable care. Now that's a very different mission statement. It's not about, it doesn't have some of the words that we heard yesterday, preeminent, dominant. I don't think we heard dominant, but it's about, number one, inspiring each other. Inspiration is such a huge part of who we need to be as an organization. And it's not just about delivering great care. It's about what the interactions feel like between people who work there. So inspiring each other, patients and families, compassionate, remarkable care. The values we also borrowed from North. Respect, accountability, communication, teamwork, and pride. Now, those are probably values that many of you have at least 2 or 3 of. It's kind of hard to argue with those. But our goal was to make those values live in our organization and hire people that knew what those values looked like and how their behaviors spoke to those. At new employee orientation, after HR brings them to a room and everything, I'm typically, after we introduce the leadership team to the staff, I'm the next speaker. And I go through the importance of who we are as an organization. And when I get to values, I talk about values being things that in most organizations are a poster. Sometimes you see teamwork with people rowing, and there's a nice sunset, and all of that is great. But then you go into the organization, and you don't see it, and you don't feel it. So our goal was really to figure out what these values would look like in our organization. And I say that I should be able to walk up to a patient being discharged at the front door, greet them and say, how was everything? By the way, we have these 5 values. And the patient should say, I saw those in my interactions with staff. I felt them, I heard them. You guys are doing a great job with that. Our vision statement was what we wanted to use to tie all of this together. And when we went to our visioning exercise, this was well before we opened, and not everyone sitting here today was even there yet. We had people who were consultants that had worked with us on the project that we brought in. And we did a fairly typical, I think, visioning exercise. Many of you have been through this. Flip charts, sticky notes, really bubbly facilitator who had toys on the table and candy just to, inspire people. I think we disappointed her because about an hour into the session, we were talking about words that would describe who we wanted to be as an organization. And what we got to was essentially the notion that when people left our facility, patients or families, physicians after a day in the OR, staff after a long shift, we wanted them to leave with the notion that that's what a hospital should be like. That's the experience that I've been looking for. That was totally different than my last hospital stay somewhere else. And so we rallied around this notion that it should really be healthcare as it ought to be. Ought sounded a little awkward, but in the end, together brings everyone into the picture, and it's about making healthcare what it ought to be. So healthcare as an 80-year-old lady with pneumonia is very different than a 24-year-old woman having her first child, obviously. But it's our job to figure out what healthcare ought to be for those patients. So 90 minutes probably into what we had planned on being at least a half day and all the toys on the table, we rallied around this. And it was something that we thought was simple, yet you will see we've tied all of our work to this. This is the foundation for how we structure ourselves and create the work that we do every day. It's how we pursue patient experience and how our employees are engaged, and then the clinical excellence that we deliver. We had the opportunity, obviously, to start new, throw traditional process out the window, think of things very differently. One of the things that we took on very early was how we were going to deliver supplies. The outcome of the discussion was what we call a patient server. Many of you probably have it. Some of you probably call it a nurse server. And I think the nomenclature is important here because it's not there to serve the nurses, it's there to serve the patient. And it was all about supplies and how we get supplies to the bedside. And what we saw in looking around the hospitals that we looked at is that in a typical 8-hour shift, nurses spend 49 minutes, give or take a few, looking for supplies. Now imagine if you could take most, if not all of that 49 minutes and reinvest it into the patient relationship that the nurse has. So we put these servers in. They're in our rooms next to the door. You can access them from the room and from the hall. So when they have to be restocked, we're not going into the room to restock. They can be stocked any time of day or night. And then we put technology around how we notify materials management that supplies are low. We added to our nurse call system with a touch screen that allows someone to go up and basically with 2 pushes of a button tell materials management that one of the trays is low, and then they get it on their list to do, and they come up and change it. Relentless focus on adding value to the healthcare experience. Relentless is a pretty strong word, but we focus on this all the time. And healthcare experience is really 2 different things. Healthcare, so what we do, delivering exceptional care, and then experience, how we do it. The exceptional experience that we're providing, the relationship that we're creating with our patients. And when you put the 2 together, it's really the bridge between the work that we do every day and can sometimes get lost in, and this great experience that we're creating. And then to support all of that, a real intentional emphasis on the culture. The culture really is the glue that holds everything together. And we think our ability to do this is part of our success story. Our ability to align people, including physicians, as you will see, around this is part of our success. So part of what we're doing today is we're going to share some stories from other people, employees, physicians, and a patient about how this looks to them or feels to them. But first, let me talk a little bit about how this plays out in terms of our HCAHPS. I'm going to add some definition to this, so for those of you that are wondering what the heck those lines mean, I'll tell you. The blue line is about pain management. We also talk about medication communication, responsiveness of hospital staff, and nurse communication as key drivers of the patient experience. A couple messages on this slide. One is we haven't been perfect at all. I'm going to come back to the blue line. When I add a few of our initiatives, you're going to see words on there that you speak to every day and things that you're doing. Pain management, AID-IT, leader rounding, discharge, instruction, checklists, all of that. Very important work. Part of our story is about how we've done that work and how we've engaged people in it. I'm going to come back to the bottom of the blue line where it says RUC campaign. That stands for Are You Comfortable? And I'm going to talk a little bit about how that came to be and why we think we saw such an elevation in our scores. At the end of the day, though, we really think that the real measurement of whether we're providing an exceptional experience or not is in the overall rating, which we all look at, and a willingness to recommend. Would you send your family or friends to this facility? And when I layer those on, it proves my hypothesis, which really isn't scientific, but I have a hypothesis that it's not about getting everything perfect in the work that we do. Yes, you want to improve and you want to see lines going up, but at the end of the day, have you created a relationship that means something to that patient? Have the staff and physicians and volunteers and leaders engaged in such a way that patients leave the facility saying, that's what a hospital should be like? And I think what this demonstrates is that we've consistently outperformed individual initiatives with this. We've been in the top 10% since we really started to measure it. We've gotten as high as top 5, top 2% in overall rating. We lead the state currently. I say currently because it's a challenge. Everyone in this room knows we're working really hard to raise those scores, and the bar continues to get raised. But I'm convinced that culture is what gets you into the top 10% and keeps you there. It's not just about fixing process and doing things a little bit differently. The real story, though, I think, comes from what our patients tell us. We know what the data says, and data is obviously important, and we all deal with it. But at the end of the day, it's our patients that have to tell
When
the
I first
story.
arrived at the hospital, I was received immediately and quickly brought to a private room where my pain was immediately assessed along with what might be wrong with me, the overall situation that was going on with me. I felt extremely fortunate to not be grilled immediately with insurance information. I had given that information to my dad in the car on the way there, and graciously they let him handle it until my situation was completely assessed and my pain was managed. The level of care from the staff was far superior to anything that I had expected or imagined. Their level of care was more of inquiring about my well-being overall, not just what they're trained to ask or offer in their room visits. Yes, they did ask me what my pain level was, but they also were interested in where was I at? How was I mentally? How was I emotionally? How was I sleeping? How was I resting? It was the whole overall experience, the environment, who was coming in and out of my room, the times that they were coming in and out of my room. Not only to me, but that it extended into who was visiting me at the time. So their level of care even extended into my son, my parents, my family, people who were visiting in my room. I always felt heard, and I always felt comfortable enough to present any questions or concerns that I had. There was one particular night where I knew that I probably didn't want a specific nurse back, and so I did request that another alternative be put in her place. And I did learn that another nurse that I'd really liked was working that night. However, she was in a different station. So I don't know what they did behind the scenes with scheduling, but they did arrange for the switch out to take place so that this particular nurse could be my nurse that night. I think most people would say that the nighttime part of the stay in a hospital is not the easiest time or the best time. In fact, most people kind of joke around about how you don't sleep at night in a hospital. And I have to say that most of the nights that I was here, I did have a good night's sleep, mainly because of the partnership I had with Judy, who was my night nurse. Not only is it just the fresh environment, the peaceful surroundings, just the overall decor, the private rooms, just how everything is set up so that you're assured of having that peaceful environment in your room, but it's the staff. I made friends with some of my nurses. There was one nursing assistant in particular. Her name was Emily. I wanted to take her home with me. She was fabulous. I know that she was outside of her shift when I checked out of the hospital, and she went the extra mile to be the person to just discharge me when it was time to go home. There were many people here who I felt like I was leaving my friends, and I wanted to come back and stay in touch with them, and I'm just very grateful for the experience that they provided me with.
That's what healthcare should be. I didn't have a pause for applause in my script, but thank you. Notice what she talks about. And I seldom have a patient write me a letter or talk to me in the hall and say, I just have to tell you, that was the best colonoscopy I've ever had this morning. It's always about the people that are involved and the little things they do. It's about, listen, she used words like peaceful environment. Well, we know what units can sound like, especially at night. And what goes on at the station, we're very deliberate about creating a peaceful environment such that even when our med-surg unit is full, or even our birth center at 340 babies, one day having 20 in one day, you walk through there and people say, do you have patients here? It's that quiet, but that's how it should be. That's an important part of healing. We all know that, but it's tough to do. So Anne shares a lot about people, the friendships that were created, and it's not as much about the IV that she got or anything like that. That's really what I think matters and drives the patient experience. And as leaders, I think it's our job to create that environment. It's our job to support the people that provide that care, and it takes the willingness to get in, elbow to elbow, directors with managers, managers with staff, whatever it takes to help lead people through that. So the first team I want to talk about is Pete. our Patient Experience Advisory Team. And what I want to highlight first is how this ties directly to our vision. I talked about how the vision is how we structure our work. So Pete really focuses with as it ought to be. How do we deliver the patient experience? How do we represent the patient? How do we keep the voice of the customer, the patient, in our decision making? It's a cross-functional team, staff, volunteers, patients, providers, leadership. It's supported by our clinical effectiveness folks, not quality. We call it clinical effectiveness. And it's a little bit different. We take more of a performance improvement approach in our clinical effectiveness. So we don't have people that have been really good at 20 years at pulling data, creating big reports, and sending it out. We have people who help tease through what the issues are and then help facilitate the improvement. Katie and Linnea are too. Wave. They're our PI ninjas. It's a very different look and feel. And I should probably tell you too that we take a little less traditional approach to even some of the leadership. Structure, background. Kate is our director of HR. When I hired Kate from Golf Galaxy. I wasn't looking for another person with a lot of healthcare HR experience because I can go to Fairview, I can go to North, I can go wherever I want for that background if I need it. But I wanted someone who viewed HR from a different perspective. I want quality folks, clinical effectiveness folks, who look at quality improvement from a different perspective and bring a different lens to it. So, a little sidebar. Pete makes sure that the work we're doing is consistently centered on the patient. They look at innovative ways to change the way that we do things. One of the things that this team took on 6 months after we opened was pain management. And if you remember that graph and the blue line, that was the first thing that we said, oh my gosh, we're at the 20th percentile. We have these great other scores and people love coming here, but we're just not doing well on this. So Pete took that on. Multidisciplinary. And what they quickly rallied around was a notion that we may not be able to manage pain to everyone's level of satisfaction. But what we can manage and what we can influence is comfort. And everyone has a role in that. And I got to tell you, it wasn't a clinical nurse specialist or an advanced degree nurse who came up with all of this. It was dialogue with a guy from materials management, a security person that we contract with, an EVS employee, with these clinical specialists that came up with the notion that we all can impact comfort. So a security guard, as the patient rolls up at the front door, has a role in how they greet that patient, how they help them out, do they get them a blanket, how do they talk to them while the husband's going to park the car, all of that. And people articulate that role. And so out of that discussion came, are you comfortable? Now, I'm not a fan of buttons or banners, but we actually have a button, which would have been really good if I had brought one. And it's small, and it just says RUC. And the notion of that is a reminder that we have to continually ask not only patients, but each other as coworkers, is there anything I can do to make you more comfortable? What we have found is the gap between the pain score and a comfort goal, which we establish with our patients, a goal for comfort, the gap can be closed by 50% by things like repositioning, changing the light in the room, getting them a blanket, things like that. Very simple things. They're not scientific. But when you make people a little more comfortable in their setting, that gap closes very quickly. And the result of that work was that in a year's time, our score went from 66.5 to 76.5. And we're still working on it. And there are other initiatives that we have to put in place to do that. But it's a multidisciplinary approach, again, in a culture where people understand that they have a role in that. I want you to listen now to Dr. Wright. Dr. Wright is our Chief of Staff. and Chief of Anesthesia.
I think what I'd like to tell you about is a vision of better care, of care that is provided by people who are not distracted and allowed people to come here and deliver care with others, feeling as though they're operating side by side, arm in arm, and not looking up or down a hierarchical ladder. It's a collective feeling of responsibility for everything that happens here, from cleaning the floor to putting in a new knee. That feeling has permeated the entire organization. The physicians have picked up and are motivated by what they see happening around them on the floors as the nursing staff takes excellent care of our patients. And physicians like myself who've come from other organizations where this cultural feeling has not been present or isn't as strong are thriving and responding in a very positive way. That cultural creation process was not an accident.
No, it wasn't an accident. Dr. Wright usually isn't that subdued, you might imagine. I asked him after this if he was in the Pyxis in the OR for any reason that morning. But he's very deliberate about the statement he's making about that everyone has to work together as a team. That clinical excellence doesn't just happen, it happens because of a culture. HEAT is our newer team of our three, Healthcare Excellence, and it ties right back to delivering healthcare in our vision statement. It focuses on things like practice improvement, how do we find best practices, what are they, how do we make them work for us, how do we create this engagement and responsibility of frontline staff in practice. It's cross-functional, membership from all over. It's also supported by our clinical effectiveness folks, but it's about innovation and integration of the work that we do. Like I said, it's the newer of our three because we wanted to work first on some of the patient experience and then also workplace experience, which I'm going to speak to. And to lead us into that, I want to share the story from one of our staff members. This is LaDawn. LaDawn was introduced to me as a security officer before the hospital opened. We had one entrance that we let people in and out of while the hospital was kind of under construction and being finished. LaDawn was someone who staffed that desk. And what she saw was that we were really going to make this place something different. And she got really engaged in that. And now she works in our EVS department as a lead.
I feel that my role as environmental services team lead is just as important as a doctor, nurse, or respiratory therapist. I feel that I can impact the patient care, and I really feel like I am part of something bigger. The leadership here is very supportive that we are given enough time to interact with the patient while we're in the room or in the hallway. It's not just the patient, but it's also the family. Everyone here is very conscious of, anticipating the needs before they are needed. If you see a family member in the hallway that looks like they're cold, we offer them blankets or a cup of coffee or water, and anyone can do that. It doesn't have to be a nursing personnel. It can be anyone, and the leadership is also very active and are often walking around doing the same thing. So we're supported and feel very comfortable in that role. I'm owning this hospital as my own. I take great pride in my work, and I feel that if I treat others well, then someday I may be the patient and someone will turn around and treat me well. It's just a model that I live by, and that's the way I am. Come in with a smile on your face. If you smile at someone, they're going to smile back. If you're crabby and frowning at someone, they're not going to smile back at you probably. This is my hospital, and I'm proud to be part of the team.
I could listen to that 20 times a day, because that tells me that as a leadership team, we're doing something right. That commitment, that dedication, you just can't teach that. It's foundational, and it's about hiring the right people that when you describe your vision and who you want to be as an organization and what you're going to hold people accountable to, you can see it in their face. And if they don't light up in an interview process and say, yeah, I want to be part of that, don't hire them. It's impossible to get them out. And you know, but that kind of ownership really just creates commitment and dedication. And I want to tell you about the respect that people have for everyone on that team. A few months ago, in a meeting, a hospitalist was speaking about how important everyone's role is. And he said that before he goes into a patient's room, if he sees someone from EVS in that room, he moves to the next room. Because he understands that the relationship that they have with the patient and what they're doing in that room makes a difference. Now that's incredible buy-in. And maybe that happens in a lot of places. I don't think it does though. It's creating a culture and holding people accountable to it. So the third team is wheat. I know you're getting the theme here. Wheat, Pete, heat. Wheat is really looking at how we engage our employees. What are the practices we have, the policies and procedures? They've taken on things even like scheduling, 8 hours, 12 hours, what makes sense? Not from the employee's standpoint, but what delivers the best care in that setting? How do we need people staffed? And if it doesn't work right, it comes back to wheat to help solve the problem. It's about how we celebrate, how we have fun. A few weeks ago, we had Culture Week. We had Culture Week because we were starting as a leadership team to feel that we were losing some of the cultural foundation that we'd worked so hard to establish. People were starting to tell us things that, in my mind, were beginning to identify cracks in our culture. And before they become big cracks, you want to get on them. So we had a week where we talked a lot about what it means to be an employee here and kind of re-up our commitment to it. If you know what a Wordle is, we did a Wordle for our hospital. The word that stuck out the most in that, and I don't remember how many people contributed information to it, but those of you who don't know what a Wordle is, you put in a word to describe whatever we're talking about, in this case our hospital, and what it means to work there and what it looks like. And the more times a word is mentioned, the bigger it gets in this diagram of words. Teamwork was our #1 word. It stands out the most. Pride, culture, and usually I carry it around with me in my notebook because if I ever need a boost for any reason or a reminder of why we're doing the work that we're doing, I can look at that. So we took that on. How do we celebrate? What do we do during hospital week? What do we do when there's not a week to celebrate anything? How do we carry that forward? And I think this kind of engagement gets you a couple of things. It gets employees who help lead the organization with you, who understand what leadership is about and they own that. It gets us, it's gotten us, a spot on the top workplaces in the state of Minnesota for the 2 years that we've been open and in that survey. But it gets a culture of one team and a team where people can align with a single vision and can describe it and act on it and tie their behaviors to it. This is my one consultant-like slide. It looks like it came from a consultant, it really didn't. But it ties everything together. Our vision statement on the top, our teams, and then diagrams of people. Back and forth, up and down, but what you notice in the middle is culture. I was looking at this the other day and I thought, you know, if that was a sandwich, culture would be the meat of the sandwich. But culture is really what ties all of this together. A few months ago, I heard a speaker talk about culture, and he said, culture is what happens in your organization when leaders aren't around. And I paid attention to it, but I keep thinking about that because it makes a lot of sense to me. We're all here today. Culture is what's going on when we're not there to direct, to lead. In fact, sometimes culture happens in spite of our leadership. So culture is really the glue. Otherwise, you just have people running the meetings all the time with no purpose. Parting thoughts. That it's not just what you do that matters, it's how you do it. I use this line at employee orientation because I know we all have a vision statement that we talk about and tie ourselves to, but I'm convinced that it's culture that really determines our success in providing an exceptional experience. We've heard people refer to pillars. I have this theory, it's my other hypothesis, not tested, it's just my thinking. There's a lot of great work out there. Studer, to me, is a great organization that takes people that are really trying to figure out how to elevate the organization's performance from the 20th or 30th percentile and get it up. And what I see is a lot of organizations get to the 85th or 90th, and then they hit this wall. And they beat their heads against it saying, how are we going to get over that? How are we going to get over that? To me, it's culture that gets you over that. It's engagement of staff around what I've been talking about. Best way to share that, though, is through our staff.
My experience in feeling the culture different here really started the day I walked in the door, and even during the interview process.
Everyone just works so well together as a team and really, really is appreciative of you. Teamwork is very important. We have a yes attitude here, and no matter what department you work in, we all work together.
Maple Grove Hospital is different from any facility that I've worked at before because of the people that work here. I mean, it just seems so family orientated, so nobody's better than anybody else. You're treated like a big family.
We actually see administration, we see the CEO. He's visible, so you feel like, you know, he really cares what we're doing here, and he really wants to create a culture where, you know what, you can walk into my office and just say, hi, how you doing? I mean, it's not all about, I have a problem and we need to solve this.
The culture here is great. All my coworkers, it's wonderful. The support I feel from the top on down, from the CEO down to the volunteers that are here. It's a friendly atmosphere. Everybody knows each other. Everyone makes an effort to get to know each other.
Actually, when I think about RUC, I think about it from the minute I get out of my car in the parking lot. I start thinking like a patient, because this is my hospital. This is where I come and I spend my free time. And I think of every moment, what do they see? What are they feeling? You know, whether it's trash in the parking lot or just something to make them feel comfortable. Their entire experience is what I want to be important to them and make sure they're comfortable.
You just felt like you had that personal touch. And so that's just what makes working here and being a patient myself so great.
Surgeons are known for being difficult personalities, and some of us, you know, yell and scream and throw stuff. And I think we've developed a culture here where that's just not acceptable. And we've had some experiences where folks come here and they find that behaviors that have been tolerated elsewhere aren't tolerated here. And that's been supported also by the administrative staff, which I think helps a ton and has made our operating rooms a happier place to be.
A bad attitude isn't going to be tolerated, and you're accountable for your actions, and it's an adjustment, I think, to get used to when you, depending on where you come from. But I think it's just a wonderful place to work.
There's been times when I've actually ended up having conversations and staying longer in the room than actually anticipating, but some people start talking and you just don't like to leave them hanging once they, you know, so when you leave, you always try to make them feel as good or better than when you got there. So I have quite a few stories on that with different people, so it's kind of fun.
The culture is so unique that we don't just take the approach of managing pain or just kind of the one way to managing the patient's care, that we really do pay attention to the holistic view of taking care of the patient.
You're responsible for the culture here. There's an expectation that you're going to be a team player, you're going to do your job well, you're going to take care of the patients. Of course, patients are priority, but I also feel like from an administrative level, the employees are valued in that way too. It's not just, I'm going to tell you this is how we're going to do it. I honestly feel like staff has input, and that's valued.
I love being here. I enjoy the atmosphere. I think people believe that a nice paint, a nice carpet, and calming sounds and whatnot are kind of fluff in my part of the world, in the sort of the surgical professional part of the world. But I don't think they're fluff. I think they help people to heal. I like being a part of an organization where I believe I'm actually a part. You know, people listen to what I have to say, and in turn, it's my responsibility to listen to what they have to say too. And so I love being here. It's been a great privilege to be a part of it.
So that's really our story. I gotta tell you, it's really cool to work in a place where unscripted, people can speak to the culture and use the words that they use. It tells me that we found a way to get people engaged around a single vision, really, which is really what our story is all about. My hope is that somewhere in this you found some inspiration or a different way of thinking about something, because you can't just take this and move it to your place. The analogy I use is, we're from Minneapolis. We're not known for stellar NFL teams. We had 1 year with Brett Favre, but that was pretty short-lived. But if I was to go to New York or Green Bay or the recent Super Bowl winners and get their playbook, get a copy of it at their conference, and take it back to Minnesota and give it to the Vikings and say, here you go win a Super Bowl, it's just not going to happen. Different coaching staff who motivate people differently, that create a different vibe in the team. The personnel is totally different. Do we have a great quarterback? Do we not? We have a great running back when he's not hurt. But you can't expect to just take something and give it to someone else and say, now you're going to be successful. You have to find what works for you, and you got to have passion. You've heard that from other speakers, but you need to do a gut check on your passion level. If you didn't have some passion, you wouldn't be here, unless you made someone mad and they thought they were punishing you to send you to this. But you get it, or you wouldn't be in this room. So hopefully you've heard something that inspires you that it can be different, and that really together, all of us in our facilities can deliver healthcare as it ought to be. So thanks for letting us share our story. Now, I see that Lynn has been lurking over there, as he said he would, but we wanted to leave some time for question and answers with the team, and you can see kind of their roles and everything. Obviously, if we run out of time, we'll be around for a while.
You got plenty of time for questions and answers. We're not going to change that slide so you'll know who to respond to. You have a question already right there. Let the microphone in the back. So give us your name and your organization.
Maybe you guys would like to come up here.
Eric Doucette, Niagara Falls, Canada. So Lynn,
Got
just
a question
for you,
in the back, and then we'll come to you.
So Lynn, just for you, I keep moving around the room just to
I
confuse
know.
you.
Thank you. You're confusing me.
Andy, I just wanted to say that sometimes it's not the best compliment to always be known as the best speaker, but it's a great compliment to be known as a great speaker. And I really want to celebrate you and your organization and the work that you've done. I came to this conference looking for the connection between interprofessional practice, collaborative practice, and patient-client-centered care. And it wasn't until your presentation when I found it. And I really want to celebrate that, because as I listened to people describing your organization, I didn't hear words like buy-in, drivers, sell, convince me, evidence. I heard openness, dialogue, engage, explore, share our experience. And I applaud you for that. I think you've done a fantastic job, you and your team. Thank you.
Thank you. Now, the one disclaimer is that it's not perfect. I mean, you heard Anne, the patient, talk about the person that she really didn't connect with. That's going to happen for whatever reason. But the important thing is, what do you do about that? And really, we leave it to staff and to leaders on units to figure that piece out, and they move someone around. It wasn't about, well, that doesn't work in my assignment, or that throws, now I have 5 and she has 4. It's about doing the right thing for the patient experience.
Maya, right there. You'll stand and give us your name and the location of your organization.
Hi there, I'm Sue Murphy. I am from Vanguard Health Chicago, so this is my welcome, everybody. No. And again, I want to just dovetail off of what the gentleman said behind me, that I can see why this leadership team must love working with you every day.
Well, they didn't say that.
Look, they look like they love working with you. No, you can just tell. You can feel the passion with your groups. You should feel very proud of that. That doesn't happen everywhere. My question really has to do with maybe just some advice that I may need in my career in helping with the patient experience is the word accountability. I heard you say it often. I understand about the culture. And I think when I sit with leaders and we coach and we mentor, the how-to accountability, how do we make it happen? Sometimes we use the word, I can almost see the color drain out of their face because they're just not really sure how to hold people accountable. We get the tactics, it's just that part that I think we're kind of stumbling on, and I just need some advice on that.
Well, I'll start. I think accountability has become a word that people just hear and they don't really think about what it means. I was in a meeting with some IT staff a couple weeks ago, and someone said, gosh, it sounds like you've got a lot more accountability at Maple Grove than we do at our facility where we work. How do you do that? I said, well, first of all, accountability has to be kind of from the top down but the bottom up. Leadership's job is to role model accountability, take accountability, good and bad. So I'm not perfect, but I'm willing to sit with these guys and say, that was a pretty stupid decision I made, if they don't already tell me that. I have to take accountability for my actions. So when I talk about accountability and orientation, yes, it's an expectation of our employees, but I quickly follow that with, you should have that expectation of me. Doesn't matter what my title is, we're all in this together. And you heard some of the videos speak to, it doesn't matter who you are here, we all have a role in this. But accountability at the employee level is something that they have to get. The middle manager is the tough role because they're right in the middle of this top-down, bottom-up approach. So what I tell folks is you have to try to inspire accountability. You don't teach it. Just because you say it, it doesn't happen. You have to show it, you have to catch it, you have to role model it, you have to support it, you have to facilitate it, all of that. And there's no easy way to do it. You can read a lot of books about accountability, but at the end of the day, the best thing you can do is hire people who get it and get people out that don't.
I just want to add, Colleen Nadeau, Director of Acute Care, and I think Linda would say this too. I just want to add to Kate, I think one key piece that we all stay very committed to is leadership presence. And so to be able to do what Kate just decided, we always talk about 50% leadership presence out on the unit. To be able to do that, they need to stay very connected to what is going on. And staying connected and being able to coach and have those candid, courageous conversations with staff, coach staff so they can have them with each other is just critical. And we as a team do those kind of reality checks together and say, there's getting to be too many meetings, let's do a check-in, let's start to erase some of these meetings. We got to get back to the 50% presence out on the units again, and we're very intentional about that.
Any other team members, please?
Obviously,
I knew they'd warm up.
Well, I think you nailed the topic that is probably one of the greatest challenges. And we had, I don't know if you picked up in the presentation, though, we used the word that what's required is that we are relentless. And we had a lot of discussion about that word because it can seem a little negatively bent, but I kind of advocated for it because the reality is it is a relentless process, and you don't just name that we want you to be accountable and you become accountable. It takes, as Colleen described that, presence of leaders, and part of that relentless piece for us is that when we get busy and we all are in meetings all the time, we have to step back and say, what are we valuing and what are we trying to accomplish, because we're not empowering, enabling our leaders to be present because we are scheduling them up. And we have to continue to do a recheck on an ongoing basis. As Andy said, it starts with orientation, and it starts with the hiring process in terms of who you hire, and the message from even the hiring interview about who we are and what we will hold you accountable to, reinforced in the orientation process. But right from the beginning, we have managers who will then notice that a new employee starts to slip into sort of those behaviors that were acceptable at other organizations. And she'll go right up to them and meet with them and say that that behavior may have been okay where you were, but in this organization, this is the value that you've committed to, these are the behaviors you've committed to, this is the work we've committed to, and we expect you to join. And we're okay with saying, if that doesn't fit you, it's okay to go somewhere else. Not in a negative way, but just to basically say this is who we are. And so it's that relentless continuing to visit that we believe has made a difference.
Anyone else? I know there was a question over here.
Hi,
Oh,
Sean Kaiser with Novant Health in North Carolina. One quick comment. I agree with, I think, Eric. I feel like I'm looking at the good to great A-team up here on the stage. It's your
Well, you're the best speaker ever, Sean.
Whatever. That's ridiculous. People know. What inspires me so much to be consistent with your vision is your humility. So congratulations on having an approach that says we're open and we're considerate of what people are going through, and that blows me away. Two quick questions. When you said you saw some evidence of some cracks in the culture, do you mind sharing any glimpses of what that evidence was so we can be mindful of it? And then the second part question, if you have time to get to it, is when you say inspire each other, do you have specific expectations on how we inspire, or do you just let it take care of itself because you have clearly a great leadership team? Thank you.
I'll start with the second part, and then I'll let them speak to the cracks, because some of them identified them. There's nothing specific about the inspiration piece of it, other than you know what behaviors don't inspire people, and you can start there, and you can catch those, and you can do something about them, and you can speak to them using the language that we've been using. So no, nothing specific about how we inspire, other than we focus a lot on behaviors, and we support behaviors that we know lead to a more inspirational environment in the work that we do. We support people that do great things. We catch them and recognize them in the act, but we also do something about the people that don't inspire. And we encourage staff to approach their coworkers and say, you know, that's not really working for me today. Why don't you go take 5 minutes and I'll cover this, but please come back with a different attitude. Now that doesn't happen all the time, obviously. I mean, Maple Grove is not nirvana, but it's a start. So someone can speak to the cracks.
I'll start and you can.
Oh,
You guys are never shy. I don't get this.
It's just want to be courteous. I'm Jennifer. Thanks for listening to us and with us this morning. I think as we built Maple Grove Hospital, we didn't hire new grads or new employees that hadn't had an experience elsewhere. So I think we all came from a long history of this is how we always did it, or this is the way we've always done it. Except for Kate. She's special. And I think when we started to see the cracks, it was those employees that maybe said, well, I'm too busy, we've grown so fast, I don't have enough time, I'm just going to revert back to the way that I did it at my past organization. So I think that was some of the first times that we've noticed what those cracks were. So I'll let Colleen speak to.
Yeah. Well, I was just going to say, because of the leadership presence, is that typically we do start to see it real time in just staff with wheat, and also the leaders, is we're just not seeing teamwork and those types of things. But also, we do look at our patient satisfaction, and we do believe, obviously, that there's a direct correlation between employee engagement and culture. And when we start to see those slip, we do see a direct correlation with staff responsiveness and start to see some of that slip. And we know, we're starting to see some problems. And typically it is with, we need the leadership, presence. We need to stay real connected. We need to understand what's going on with staff. We need to reset ourselves. And so just constantly staying on top of that.
The cracks for me were identified at a more personal level by people who came to my office. Our manager of EVS, who's not our employee, but Aramark's. Katie and others who came and just said, it just doesn't feel like it used to. This is what happened yesterday. Or the EVS manager just saying, I think we're starting to lose our grip a little bit on what we said we were going to be and how this was going to feel. Man, that's a wake-up call. And it was at that point that I said, okay, we got to do something about it. We need to pause, because if this crack gets any bigger, then it's going to take a lot more effort. It's always easier to patch a small crack than a big gaping hole.
I think the comfort, and I'm the Director of Support Services, so the comfort that the EVS manager had to go into the CEO's office to identify that. Each one of our employees are a Chief Experience Officer. They proudly wear a CEO badge. So within their teams, they could identify it, and they have the opportunity to work as a team. So it's not that it has to go to the supervisor or the manager or the director of that department. They within themselves see the cracks and will identify them and continue to work on them. So it's at every level that they're able to identify them and have the comfort to then call it out and have support to get it fixed.
Question right down front. Denise is right. Oh, Maya, Denise, it's going to be a race. Okay. Maya's going to win. Let's hear it for Maya. She won the race,
Hi there, Joan Boysen, Chief Operating Officer of a town you might have heard of, Faribault, Minnesota.
Oh yeah, it's much colder there.
No, it's south of where you guys are. Anyway, I was intrigued by the comment of leadership presence 50% of the time on the unit, and our CEO also talks about leadership presence and an expectation that if your department is a 24-hour operation, you are present on each shift. So how is that actualized at your hospital?
Well, I don't do that because I'm the CEO.
Fair enough.
No, I mean, they can speak to it because, they're responsible for those units. But for me, it's someone says, hey, you should come to one of our staff meetings. Okay, when? What time? I'll be there. Employee events that we have, night shift, we serve stuff. If it's food, it's typically 2 in the morning. I'm there, cooking eggs. Not well, but I'm cooking them. So it starts with me, and it's holding these folks accountable, but they're getting up to 30-hour weeks now of work.
I'll just say one more thing that hopefully becomes a theme throughout this, and I'll relate a story to this as well, is I think what Andy had said is hopefully things resonate with you, but we don't have a lot of programmatic scripted answers. So much of this is built into what we are, who we've become, that there isn't the answer. So, if I'm working on a weekend, I hadn't fulfilled my 30-hour commitment for the week, so I come in on Saturday. I think all of us do that occasionally, or if we're here late at night, you walk through the units, and people are like, hey, it's great to see you. I don't usually see you during the day, so you sit down and you engage them. What's going on? They all have our cell phone numbers, which are off right now, by the way, so we're good for a few minutes. But I think it gets back to that foundational cultural existence that I think the challenge, the luxury we had as we get to build it, the challenge for an existing organization is trying to steer the ship in a different direction. So I think it's maybe a different journey when you start in a place to try and get to versus we scripted a place. But to get back to the non-programmatic, Becky, who you saw in one of the videos a couple times, and I'll probably get the story a little bit factually inaccurate but spiritually correct. You saw people in the videos, and none of us decided to wear our ruck buttons, but everybody wears their ruck buttons because it's attached to their ID badge, which we didn't bring. But she said, "I hate ruck," or "I don't like ruck." Well, why not? She said, "Well, it's a program. Ruck isn't a program, it's just who we are." And I think that speaks volumes about what we're trying to do and what we're trying very consciously to build and maintain. And I think all of us up here would agree that maintaining that is no easy task. It gets harder every year as the organization grows with complexity. But I think it's our firm foundational belief that if you've got that foundation, that structure, that commitment from people, programs aren't necessarily the answer. So I'll let anybody else jump in.
Yeah, I was actually, to affirm what Craig was saying, I'm Linda, and I work with family care services and a lot on the nursing units. And I think that notion that it's not scripted, but it's built into the fabric of who we are is a critical element. And so you don't prescribe or you don't orchestrate that, but when you have people who are driven to those relationships, they care about those relationships on a 24/7 basis. Now, obviously, everyone's a human being, but when we're in the building, we want to make that connection. Or I have managers who then say, "I'm going to come in at 5:30 today and connect with my night staff, but that means I might leave more like 2 o'clock." And how do we support that as well? So it's really not around requirements as much as knowing that they are themselves inspired to connect with their staff because they have relationships with all of them. They want to be with them, they want to mentor them, they want to encourage them. And so within a context of what's humanly possible, it's allowing for that personal inspiration to drive that.
Another question or comment? Question or comment? Very back? Yes, Denise, you got her. That's right.
Hi,
Let's applaud for Denise, who's standing right next to the lady. That's Edie people.
It's like lightning. Oh my gosh. My name's Kelly. I'm from Chatham-Kent, Ontario, and as a new middle manager, how would you suggest I bring this message of top leadership engagement down to my level and down to the floor and down to the patient level when I have a senior leadership that tends to be off in another building and very not present?
Well, go tell them to get their butt in gear and do the right thing.
My resume ready.
Bring them to the next meeting. You know, I get that it's risky in some organizations to go into the C-suite and say, "Hey, I just went to this meeting and they basically said that what you're doing isn't working well for us." I'd find your own way to say it, but there's a risk in that, I think, in some organizations, and that's exactly what we're talking about. That's just a shame.
Can we have them call you?
Sure. Is accountability a value for you? Is it a stated formal value in your, well, there you go. I'd go and I'd highlight that and say, not so much. This really isn't working for you. I think you're on.
Came from your
yeah.
I've done
that before.
I guess I would just say there's no better way to do it than just to start doing it. Craig talked about changing a culture. We had the luxury of creating it from the beginning, but don't shy away just because it's been like this and, oh my gosh, those people are never going to get it. That's the passion that you have to have. And I think you come to these meetings, hopefully, to get a little re-inspired and charge your battery a little bit and get some new ideas. But I don't remember which speaker said it, but we talked about the binder and how it goes on the desk. And oh my gosh, I've got to go through those notes because I'm gonna make big changes in this organization. And then it starts to get pushed aside and everything. It's hard to keep up with that. But one person, you have to believe, can make a big difference. And it's not going to be overnight, especially in an organization that's been there a long time. But find a senior leader that you're comfortable with and sit down and talk with them about, so hey, there was this whole theme about accountability and this leadership team from Minnesota, pretty close to Canada, that's really inspired to do the right thing and help lead the organization. What can we do here to create more of that?
Thank Andy and the team for a great presentation and question and answer. Thank you.
Yes, we're done.
I know there was one more question in the back, and I apologize for that, but to keep us on schedule, I want to let you know that we want to send you back, not just with more knowledge to help you do an even better job, but we want you to take with you a new outlook on healthcare and your important role. To do that, we want to help motivate you, and to do that, we want to have some fun. And our concluding speaker, when you see her in action, as I have, you will go away with plenty of motivation and tons of fun. So make sure you're ready to laugh when you come back. And Fran, can we start the music that you wanted for the break, just to kind of give them an idea of what your session is going to be like? David, do you have it? Go ahead. This is, we'll get you energized for our next session. Back in here in 15 minutes with Fran Solomon.